Good morning, everyone. This is Dr. Christopher Kotwicki, chiropractic physician at Gulf Coast Rehabilitation and Wellness Center. I'm making this video for you guys today to talk a little bit about the recent news of hydrochloroquine and chloroquine being approved as off-label drugs for the use in novel coronavirus in severe cases. So what actually happened, and if you've been watching the news, you're going to hear a lot of, this is a scientifically unproven drug. This is clinically unproven. This doesn't work and all these things. So let me explain what this actually means. And what they're saying is true, but it's also a little bit misleading. So I just want to give you guys a little bit of education because, some people are freaking out. Everybody's freaking out. But, I just want to reassure you, do not panic. I'm going to touch on some things that you can be doing to, take action and help prevent and fight this virus, and other things that you need to be aware of, that things aren't always as bad as people try and make them out to be, but that this is still a serious issue. So let's talk a little bit about what happened recently. So the FDA approved hydrochloroquine and chloroquine as off-label drugs to be used with COVID-19. What that means is they have been scientifically studied in other diseases such as malaria, rheumatoid arthritis, and lupus, and they have been found to be effective and safe in those populations. What we do not know is if this is safe and effective in populations with COVID-19. Why don't we know that? Because we haven't done a double-blind placebo-controlled study. That means double-blind is when the doctors and the patients don't know if they're actually getting the drug or a placebo. A placebo-controlled study is when you're getting the drug or a placebo, which would be a non-therapeutic agent, often saline or sugar, and see if there's actually an effect and to see if the drug has a stronger effect than the placebo. The reason that they have to do that is because there's a mind-body relationship, and this is documented, this is scientific truth at this point. When you think something is going to help you, you actually get help from it. So that is the mind-body relationship. That is the human psyche causing an effect, a physiological effect. In other words, people who are more optimistic oftentimes have better outcomes, and that often has to do with thinking it's going to work and that actually causing a physiological effect. So people who get the placebo sometimes get the same effect as people who take the drug. And that's because their mind-body relationship is working. So we know that in animal studies there's no placebo because animals don't know what's going on. They don't think they're taking something that's going to help them. So we've never done any trials on these drugs, specifically in populations who have tested positive for COVID-19, and we haven't differentiated between populations. So that is what they mean by it's scientifically unproven. There is no study to say this. But does that mean that it does not work? It does not. Absence of evidence does not mean evidence of absence. In other words, if we were to study it, we may or may not see a benefit. And because of that, the best answer we can give is we don't know. So it's a little bit misleading. And it's not. It's very true what they're saying. But it's misleading because the lay public doesn't understand what that means. But the lay public also wants to see action. They want to see some sort of medication. They want to see a drug. They want to see something that's going to help them because we need it. Honestly, and this is where I'm going to talk about how this is actually a very serious disease. The leaders, there's an ambulance going by right now, but the leaders of public health and infectious disease, the experts, the people who have dedicated their lives to studying the treatment and the health preservation of human populations, have determined that this is a very serious disease because it is a easily transmittable and it's highly contagious, but it can also have a high mortality rate. It's higher than the flu. Everyone's saying, oh, it's just the flu. It's not. This is a more serious condition. And if you're washing your hands for at least 20 seconds and you're coughing and sneezing into your elbow and you're preventing yourself from touching surfaces and you're not touching your hands to your face or your nose, your mouth, anything like that, you're social distancing, you're doing your part because this is serious. if you know anyone with cancer, if you know anyone with an autoimmune disease, if you know anyone who's obese or has cardiovascular disease or diabetes, or if you know anyone over the age of 65, especially over the age of 80, this can be deadly. This is serious, okay? And I want to make sure that you guys are doing everything you can to help stop the spread of this virus. So, to recap, follow the CDC guidelines, follow the World Health Organization guidelines. This is a worldwide disease. This is affecting a lot of people. And this has, according to the latest numbers in South Korea, this has a 1 in 10 chance of killing someone over the age of 80. It has a 1 in 100 to a 1 in 50 chance of killing someone over the age of 50. Now think about how many people get this disease, okay? I think there's over 500,000 in the US. Now, if there's over 500,000, think of 1 to 2% of that. It's 5,000 people. That's up to 100,000 people. It's scary. For those of you who are healthy, for those of you who are not immunocompromised, you have a duty to protect those who are. We don't have a vaccine for this. We don't have a medication that is clinically proven. We don't have medications that are ample and ready to be used. We need to follow these guidelines. We need to stay safe. If you're getting chiropractic treatment, for those of you who are suffering in pain, you're still going to see your doctor, and we have x-rays so we can still take off, the burden of going to the hospital. A lot of you still need health care. We're using masks. We're wiping everything down. We're using our hand sanitizer, and still some people are just saying, no, it's too risky. I'm not coming in, and I understand that, and I want you all to still, stay safe. Watch those other videos that I made about the top 5 antiviral and immune boosting supplements that I recommend. And remember to check out Zinc and Quercetin and Vitamin D. Those are definitely my top 3 for specifically COVID-19. And this is a wake-up call, guys. We got to be healthy. We got to be exercising. We got to be eating right. We need to get, more fresh air. We need to de-stress. We need to work on ourselves, because in the future, if this comes back, which Dr. Fauci, the advisor who's been coming on and speaking about this, he says this may come back in the fall. So I want to, challenge everyone. I want to challenge everyone to get as healthy as they can before the next epidemic, before the next virus. And I'm here for you guys. My life has been dedicated to health. I want to help you guys be healthy. And if there's anything I can do, please reach out, leave a comment below, email me. If you guys need a chiropractor, GulfCoastRehab.us. I'm in Pinellas County, Florida. Please come see me, and I'll do my best to help you live a better and healthier life. Please like and subscribe. It helps me out, and I hope this was helpful. Please take this seriously, okay? You can help save someone's life. And in addition to that, I want to just say thank you to all the doctors and nurses, the techs, everybody who's working their butts off to fight this thing. And I know everybody is sick of social isolation. I am too. But keep it up. Keep up the good work. This will be over before you know it. Stay positive, guys. Don't panic. All right? Dr. Chris, have a good day.